What are the most common side effects of your favorite GLP-1 medications, semaglutide, tirzepatide, and how can you address them, guys? Let's talk about it. If you're new to my channel, hi, I'm Dr. Jones, DC, a holistic obesity expert. I work with medical practitioners. We prescribe these medications, they prescribe these peptides because we want to help our patients eventually wean off the medications, but with lifelong weight maintenance. The three most common side effects are nausea, we have diarrhea, and then we have vomiting. In that order, those are the three most common side effects. Let me break down side effect by side effect, what you can do, different options, guys. You don't need to try all these options, but I broke them down into categories so you can try a few of them and let me know in the comment sections which methods work best for you. When it comes to nausea, in terms of lifestyle things that you can do, we can stay hydrated, we can eat smaller meals, and we can spread them out. This is sort of intuitive that when you eat bigger meals, that's going to increase the likelihood of becoming nauseous, right? So spread those meals out over a long period of time so that you can consume the food that you need to consume and not aggravate that as well. And hydration, I've mentioned this in other videos, being dehydrated can cause nausea. What can we take from a holistic perspective? There's quite a few different supplements. I love vitamin B6. I love ginger. There's actually some great literature on vitamin B6 and literature for its ability to be able to help you deal with nausea. Finally, if those supplements don't work medication-wise, we can get Dramamine over the counter. And if that doesn't work, last solution is you can grab a prescription of Zofran from your primary care physician to be able to deal with nausea. Let's dive into diarrhea. From a lifestyle perspective, we can increase fiber intake and stay hydrated, especially because you're going to be losing a lot of water intake from diarrhea. It's very, very important to stay hydrated and replace the lost electrolytes. But fiber intake has actually been shown to help potentially remedy or at least decrease the frequency of your diarrhea. Now, from a supplement perspective, probiotics. Now, probiotics are just a whole vastness of research going on, and we know the gut microbiome is extremely important for optimal health, and we know for most people, adding a probiotic is going to be anywhere between neutral or more beneficial. Pay attention though, because if it does increase your diarrhea, then try a different strand, and if no strands work for you, then let's not aggravate the increase in your diarrhea. Now, we can also pay attention to any triggers, right? Diarrhea can be situational. It can be a reaction. For example, after a long fast, if you eat too much food, that can also trigger diarrhea too as well. So pay attention to your triggers. Now, finally, we got medication solutions. So your tried and true prescription-based solution is going to be Imodium, which you can get from your primary care physician. Now, let's talk about vomiting. Vomiting is probably the least out of these three side effects in terms of what can happen from GLP-1 medications. And so lifestyle things you can try, they have what are considered acupressure wristbands that the whole sort of acupuncture thing, guys, it works off meridians. And I've seen that work with patients and I've seen it help. So give that a try. Again, let me know in the comments if that helped for you. What we can do as a helpful thing is wear those wristbands during times of vomiting. From a supplement holistic viewpoint, we can add peppermint and we can add chamomile. I would also include ginger if you are suffering with vomiting to help attempt to calm the stomach and try to decrease the amount of vomiting. Please, 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 guys, if you are experiencing this, to try to get the vomiting under control before you continue your medication. Hopefully you're in communication with your prescriber so that you don't make vomiting worse. Nobody enjoys vomiting. It's a horrible thing and can send you to the ER in extreme situations. Finally, if you need medications, as we know, vomiting is more of a late stage nausea. And so same over the counter and eventually prescriptive medications might need to be taken in order to remedy and end the vomiting from happening. Guys, if you want to learn more about successful strategies to include with your GLP-1 medication journey, I have a ton of different resources. Click my profile icon, click this icon here, scroll to the top. On that page, you can do many things there. You can fill out your information and schedule a free consultation. If you're not ready for that, you can scroll to the bottom. It's going to say, if you're not ready to schedule, click here. What's cool about that page is that's a link tree. You can do many things there. You can pick up my book that I just published, Fast, Feast, and Flourish, on Amazon for freaking 15 bucks. It's a very comprehensive guide. You can access my online course. I'm really excited about that. That is a course and community that provides coaching. That's actually my lowest level of support. That is in an actual program where you can jump on the lives, you can ask. It's live Q&As, because I know a lot of patients out there can't afford much, and for freaking $10 a month, guys, it's a steal. So jump on that if you are in a financial concern situation, and at the very least, join my free Facebook community. All of those links are there to be able to support you guys. I hope 2024 has been a great year to you so far, and if weight loss is on the list, quit procrastinating. Let's freaking do this, guys. We'll see you soon.